And I am really thrilled that we are able to bring to you a true expert on grief, Dr. Wendy Lichenthal, who I have known for about 15 years now and have learned from. And so it's really meaningful to me that she is here this evening to present to us. I'll tell you a little bit about Dr. Lichtenthal. She is the founding director of the Center for Advancement of Bereavement Care at the Sylvester Comprehensive Cancer Center and professor in the Department of Public Health Sciences, Division of Prevention Science and Community Health at the University of Miami Miller School of Medicine. She is a licensed clinical psychologist and has worked as a grief specialist and psycho-oncologist for over 20 years. Since 2005, she has been at Memorial Sloan Kettering Cancer Center in New York City, where she was founding director of the Bereavement Clinic and associate attending psychologist, and where she now serves as a consultant faculty. She has been the recipient of numerous awards and numerous grants to fund her research projects. She has been funded by the National Institutes of Mental Health, the National Cancer Institute, the National Institute of Nursing Research, the American Cancer Society, and more. Dr. Lichtenthal is a fellow in thanatology and was elected to the ADEC Board of Directors in 2023 and to the Fellowship of the American Psychosocial Oncology Society in 2024. She is a very accomplished researcher and clinician, but more importantly, a very compassionate provider who is here to teach us from all of her experience, both clinically and from a research perspective. So Dr. Lichtenthal, I will hand it over to you.
Thank you so much. I'm going to go ahead and share slides for this presentation.
And while you're doing that, I'll just remind everyone you are welcome to put questions in the chat along the way. We will save them until the end, but if you want to put them in the chat, we will monitor them so that we have them when the formal presentation is over.
And I, at this point, will not be looking at anyone. So if you, if the sound goes funny or that people have a burning question and you need to interrupt me, please feel free. But I'm going to hide all the controls so that I can kind of focus on this. But I really am so honored to be with you speaking about this important topic about the presence of grief across the caregiving trajectory. I'll quickly, is it still sharing for you? Just went away from me. Okay, for some reason.
And we're still on your title screen.
The slides went away from me. That's,
I can pull up the set that you said.
I'm just gonna stop share and do it again. Mm-hmm. It's probably easiest. Okay. There we go. Okay. So just some quick disclosures. Some of the things I might be mentioning, I have a relationship with Meaning Centered Grief Therapy and Empower, and just disclosing some other relationships there. But that's not why we're here today. We're here to speak about grief. And before we talk about grief, we need to talk about loss. So what I want to center us on is thinking about the many, many losses that you may face along the caregiving trajectory. We understand that medical complexities and related caregiving responsibilities can lead to multiple losses. There can be the loss of physical functioning that you witness. There could be a loss of energy, both energy and those you care for and yourselves. There can be changes to physical appearance. There are losses of mobility, a loss of a sense of freedom, loss of independence, loss of important roles, both for you and your child, loss of work, loss of identity, loss of faith, and loss of the future you may have imagined. And with loss comes grief. And so that's what we're here to talk about. So what falls under the umbrella of grief? Well, such a mixed bag. There's yearning for what was. And we're going to speak about grief in this very broad term, because we're going to be speaking about grief over the losses that I just described, but certainly for those of you who have lost someone, a person, your child, we need to acknowledge that as well. But that yearning, that missing, that wanting what was is a core component of what defines grief. Along with that, of course, can be experiences of shock, of anger, of worry, of guilt, sadness, fear, anxiety, existential distress, and numbness. All of these can be characterized as part of the grief response. And as I alluded to already, we can grieve death losses, and that's so often what we're thinking of when we talk about grief, we talk about bereavement, but we certainly grieve non-death losses as well. And part of the caregiving experience, part of what you witness in your children, of course, includes those what we call non-death losses. We also can think about grief over current losses, things that are happening in the here and now, and grief over future losses. And we've broken this down, colleagues and I, because the literature in this realm, when people research grief, has been really complicated and really muddy, because how people are defining these different types of grief has been messy. And so what we found is that sometimes people are talking about anticipatory grief, but they're actually measuring here and now grief. So we've tried to unpack that a little bit just to help us make sense of the many ways that grief presents when you're in the space of caregiving. And so if we think about the here and now type of grief, we've characterized this as illness related grief, and it's present oriented. It's grief over loss of functioning, grief over things that change that you might be witnessing in your children, changes, grief over what you plans that you had, but those that grief is over losses that are occurring in real time. And we can differentiate that from grief about the future, grief that is future oriented because it's sadness and worry about the prospect of losing someone or something. And we characterize that as anticipatory grief. So grief can occur in the here and now, and it can occur as we, which is a unique capacity of human beings, imagine things that have not happened yet. We also recognize that grief can happen from the time of a diagnosis or the time of the presentation of symptoms. When your mind starts to go there and wonder, what is this? And there is the threat of loss. So that experience of loss and the threat of even more loss is often competing with a desire to maintain hope. And that push and pull, as you get more information, some information that gives you a sense of hope, some information that leaves you even more scared, can leave people feeling like they're on a grief roller coaster, surges of grief. And that's because we have a natural tendency to move away from pain and take respite from it. But one thing that is important to think about as we continue this conversation is that as feelings wax and wane, you can be experiencing both grief and hope. Grief and hope can coexist. Now, thinking about coping with grief and loss, it's helpful to know more about grief and loss. And so I want to move on to some contemporary perspectives we have about what it is to grieve. Some of you may be familiar with this, and for others, it might be just a different way to frame the responses you have to loss. Now, one of the foundational ideas, foundational models we have is grounded in what we call attachment theory. Those ideas about how we connect to other people, why we connect to other people. And those theories about attachment, when we think about why we attach, why we connect to others in our world, evolutionary perspectives will speak to the fact that connecting to others, our attachment to others, promotes safety and promotes survival. So when we think of it from that lens, we can understand that we are wired to attach, right? And we are similarly wired to protest separation. And this instinct starts from the moment we are born, right? In infancy, infants are attaching to their primary caregivers. And what's important also for those of you who are caregivers, is that we have a caregiver drive. We have a drive to protect those we care for. So those instincts are very much wired within. And that idea that we protest separation is very important, because if you look at this image on the screen and imagine that this is a toddler, and you can imagine this toddler perhaps being separated from their primary caregiver. So now, looking at this toddler, I want you to just think about whether, when you see this toddler crying, do you see this child as scared or angry? Is this child scared or angry? And maybe you can put your kind of response and your reaction in the chat. Do you see fear? How many of you see fear? If you see fear, go ahead and type that in the chat. Or do you see anger? Do you see rage there? If you see rage, go ahead and type that in the chat. And now I want, for those of you, when you first saw that image, you saw terror, you saw fear. I want to ask you, if you shift your perspective ever so slightly, if you could see anger and rage. And for those of you who first saw anger and rage, I want to ask if you could shift your perspective slightly and see fear and terror. Because this is the separation response. What we can do when we think about it from that lens, this idea that we are wired to connect and thus we are wired to protest separation, is this can be a helpful way of making sense of our own reactions and the reactions of those we care for. So what might look like total rage and anger underneath might be terror and fear, all connected to this wiring we have to be with those who can protect us, to protest separation, to protest change, and to protest loss. And when we think of these kinds of responses with that lens, that this is protest and that it's hardwired, it can do a few things. It can give us a sense of compassion to those we care for. So for those of you who are clinicians listening right now, recognizing that what you might be witnessing in those you care for professionally might be this grief response, this separation distress, might help you bring a different lens, a different state of compassion when you're witnessing that. And for those of you who are caregivers, it might help you make sense of your own reactions, right? So much of what we do, and we'll continue to talk about this today, so much of what we do is struggle with making sense of our own reactions when we are grieving, because they can feel so hard and chaotic and not rational. But if we remember that at the base, at the core, at our belly level, this is all really wired in us, it can help us make sense of what can feel very much not intellectual. The other thing that we want to keep in mind from an attachment perspective is that the intensity of our grief response is going to be related to the nature of the attachment. So whether we're speaking about a non-death loss or a death loss, the proportion of grief we have always makes sense, because it's always going to be connected to the nature of our connection to whatever it is that has been lost, or to whatever it is that is feeling threatened to be lost. And what that leads us to is something you'll now hear me repeat, which is your reactions make sense. Another perspective I want to bring to the table is this idea that grief is nonlinear. Grief is nonlinear and it does not end. There's a lot of talk about closure, healing, resolution, recovery, words like that. And I stay far away from those kinds of words, because grief does not end, because we might be forever connected to that thing or that person who was lost, right? And so we want to keep that in mind. And we want to keep in mind that there are a lot of popularized models, such as the stage model of grief. And we understand why those models have become popularized. And that's because grief can feel so chaotic. And we want something that feels more predictable. We want to understand that there's a predictable trajectory, and that maybe there will be an endpoint to the pain that we feel over whatever the loss is that we experienced. But the fact of the matter is that grief is highly individual, and that there is no set stages of grief that we go through. The important point here is that if anyone is experiencing grief over anything or anyone, there should be no expectation that you grieve in a very specific way, and therefore you should not be criticizing your reactions or wondering if you're getting it wrong. That's really why this is an important point to punctuate. It's also important to punctuate that grief is nonlinear, because so often when you're grieving something and you start to that grief and that intensity of grief starts to diminish a bit. It feels like it is not so raw or not so much in the foreground. But then it surges again because you are reminded of that loss in some way. We don't want people to feel like something is wrong with them, that they are regressing or not coping well. Grief is nonlinear, and when we are reminded of our losses, that grief can surge again. And so that is a typical expected reaction. And we say all this because we don't want people pathologizing or critiquing their responses. And that is really a lot of what you're going to hear me say. We also can keep in mind that the relationships we have with whomever we might have lost in our lives or whatever we lost can continue, and that can be adaptive and helpful, and we support that. We can have more of a discussion after the presentation about this idea, but the notion here is that when something has been impactful or someone has been life changing, we expect that relationship to continue, and we can hold that relationship and continue and nurture it. All of this to say, again, your reactions make sense. Grief is nonlinear, it does not end, and our relationships continue. So, what does happen? What's a more perhaps helpful model of understanding the way we respond to grief? Well, one model is the dual process model of coping. And you see when we talk about a dual model that there are kind of two spheres here. Now, what the dual process model talks about is that we kind of move between these two spheres where we confront the pain of a loss. And then we move to figuring out how to be in the world without whatever or whomever we've lost. And we go back and forth between the two, oscillating. So, loss oriented mode means confronting the pain as you digest and metabolize this loss happened. And restoration oriented mode involves figuring out, well, now how do I exist in the world without my person physically present or without this thing that was key in my life? And so we go back and forth, but really one of the most important things about this model, and when I'm working with someone and want to help them make sense of their reactions, is this jiggity jaggedy line here. Because what the dual process model of coping is saying is that we move back and forth between these two spheres, but we don't do it with any predictable order. It's kind of a mess. And why is that a helpful model sometimes to keep in mind? Because when you're observing yourself and you see, this morning I was weeping and overcome with feeling, and this afternoon I feel like that was a different day, a different week, even though it was just hours ago. It can feel crazy making, right? We can feel like something's wrong with us. How do we move between these two spaces? What is going on there? And if instead we conceptualize this movement as what it is to adapt, we need to go to both places. Again, it can help you feel like your reactions make sense. We also can think about this idea that we all have a natural tendency to avoid pain. We want to be compassionate to that fact, right? We have a drive to move away from distressing thoughts and distressing feelings. This is universal, it is natural. And so, another perspective we can have when we see this kind of approach and avoidance way of being is that we are dosing ourselves, right? We dose ourselves with grief. We don't stare at the sun indefinitely. And so recognizing that kind of movement toward confronting pain, but then movement back from it is something that is typical. So we don't want to pathologize a movement away from pain because that is what we do. At the same time, when we think about, well, then how do you adapt to losses? A really helpful perspective, and I think one that is particularly helpful as we are having this discussion around the holiday season, is this notion of coping flexibility. So, some of you may be familiar with this idea, but the notion of coping flexibility is particularly as it applies to grief and bereavement, promotes this notion that there's not one singular way to cope with grief and pain. There is not always something you should do. It really is figuring out more about the when and when nots of attending to your grief. And that's going to depend on the context. So being flexible in your coping is more predictive of individuals finding their way through their grief than there is one singular way of coping with grief. So what would be an example of this? Well, let's talk about expressing ourselves and sharing. Now, You'd be hard pressed to find someone it works in mental health that says we shouldn't express ourselves, we shouldn't talk about our feelings, right? Talking about our feelings, expressing feelings is a hallmark of so much of what we do as mental health support providers. So we can say that sharing and expressing yourself is helpful, except when it's not. So when would it maybe not be helpful? Well, all of you undoubtedly been exposed to someone who has said something back to you when you've expressed yourself that is not so helpful, right? And so when you try a coping approach out and it is not getting your needs met, what we would say is actually the most adaptive thing to do is to pivot and try something else. So the coping flexibility model posits that the first thing we do is we kind of take stock of the context and what's going on, and we try then to apply a certain coping approach. But the trick is if that coping approach is not working for us, we are flexible and we get rid of that coping approach and we try something else. So, come this holiday season, you might, as you confront grief over losses that have occurred or that you anticipate will occur, you might make a plan and think about, well, how do I want to be on this occasion? How do I want to cope with the fact that perhaps again someone precious is not physically in your world? And you might make that plan. But what we really might want to keep in mind is that you might try and come up with a plan, and then the day of, a different context presents or what you feel is different. So what I would just promote here is that flexible stance. Try things out, but if they're not working for you, you can pivot. Now, we talk about that. And so sometimes that means that what could look like avoidance is really someone trying something else out that might work better for them in a given context. But we also would say that chronically avoiding distress, feeling that it is something that should be pushed away or walled up or compartmentalizing distress, that is going to be something that we would become concerned about. And we can talk more about that after the presentation. So on the one hand, I'm saying that sometimes we are going to move away from feelings or expression of feelings because in a certain context that might be more adaptive and helpful. But we also want to make sure that people feel like they can be with distress. Grief is an expected and appropriate reaction to loss. And so we don't want to pathologize it and we don't want to push it away. Again, whatever you might be experiencing, particularly this time of year, I'm going to keep promoting this idea that your reactions make sense. Now, another point of view and perspective that I want to bring into this conversation about grief is around meaning. Grief and loss often can bring about a crisis in meaning because we are often loss disrupts our meaning making system. Losses can shatter our assumptions about the way the world works. It can threaten our belief system. And it can leave us saying, why me? Why then? How did we get here? How did this happen? And what now? We are driven as individuals and as human beings to make meaning of the world. We need the world to be predictable. That promotes a sense of safety. We need to know when I open the door, the floor is going to be below me and things are not going to be falling from the sky. Or otherwise, it's hard to put one foot in front of the other. So we are driven to want to make sense of the world and to learn so that we can prevent future dangers. And that is often what's happening as we're engaging in meaning making, is we're trying to make sense of how did we get here. In essence, this is a drive to learn so we can prevent future threats and challenges, right? And so part of what we then are doing is trying to reconstruct the world. This is a meaning reconstruction model of loss that is very much part of what individuals are doing. They're trying to make sense of what just happened here. And we are similarly driven to make meaning of our lives. There is a will to find meaning in our existence that is also at play. So we can have, when we experience loss, a crisis in how we understand the way the world works, that kind of meaning making. And we can have a crisis in terms of loss, the way we make meaning of our lives. And when you are a caregiver or have been a caregiver, and that role is so central to your world, when anything might challenge that role, of course, you could be left with asking, who am I now? And what is my purpose? And can life feel meaningful again when you're faced with loss? So we acknowledge that while an individual is caregiving, there are multiple losses along the way as you direct attention toward caregiving. These can be losses of other things that give you a sense of meaning beyond caregiving. So these could be other meaningful relationships in your life, other meaningful roles and activities and responsibilities. And that sense of disconnection can challenge your sense of identity. And that loss of one sense of identity, and what often happens when you have been someone exposed to the medical complexities that so many of you witness and are living alongside, is that you also have a heightened sense of awareness of mortality that the person next to you doesn't have. Right? So you're living in this very different state than many of the people around you. And the experience of medical challenges, the experience of losses, that heightened awareness of mortality can leave you feeling disconnected, isolated, different, and a very profound, of course, loneliness comes with that. And that also falls under this umbrella of grief. We grieve a sense of before, perhaps the diagnosis and the losses you've experienced. So, with that backdrop, with this setting the stage of these kind of contemporary ways we think about grief and loss, let's move to thinking about, well, how do you cope then? How do you cope with these losses? And so, I want to just introduce some notions around creating your own coping toolbox and different perspectives that you can pull on and draw from as needed. Now, first, before we get into any of the mental gymnastics around coping with loss, first and foremost, we want to validate and normalize your reactions to loss. You've heard me kind of allude to this multiple times already, this idea that your reactions make sense, right? This idea that it is not pathological to grieve. And that is so important because so often individuals are self-assessing. And again, we're driven to want to get away from pain. So because grief can feel so chaotic, so unpredictable, and can leave you feeling lost, give yourself permission to feel. Give yourself that grace. Make sense of this response. And we're going to talk more about other ways that you can make meaning and make sense of those responses. But sometimes it's important and helpful to make sense of those responses by even just keeping frameworks that I've already reviewed today. So thinking about that dual process model, when you're feeling like, why am I feeling one way, one moment, and another way, another moment? Thinking about, well, that is my process of adapting, right? I need to attend to both of these spheres. Or thinking about the wave metaphor, and as this wave of grief comes, recognizing the shape of it, that it's temporary, that it's manageable, that it's something you can surf. And again, carrying different meanings of that grief can help you make sense of those reactions and move through the other side of a wave of grief. So you'll hear me over and over promoting this idea of being with the feelings because they make sense. We're not going to fight feelings that are by design something we'd expect to be there. So this notion of, from a technical point of view, trying not to push away upsetting thoughts and feelings, because we understand that the more that we try not to feel something, not to think about something that actually makes so much sense to be there, the louder the volume on that pain can come. So many of you may be familiar with this thought exercise of not thinking of a pink elephant. If you've never heard of this before, try it for a moment. Try for a moment to close your eyes and try not to think of a pink elephant. Whatever you do, don't think of a pink elephant, right? So this idea, without belaboring the point, because I think probably many of you have heard this before, this idea that the more we try not to think about something, by focusing on not thinking about it, of course we're thinking about it, right? So the same idea goes for our grief and our pain. If we say, I shouldn't be feeling this way, I don't want to think about this, I can't think about this, I should not think about this, the volume on that pain actually will get louder and it'll have kind of a rebound effect. So maintaining compassion toward your thoughts and feelings is an alternative, choosing helpful meanings like, of course, I feel this way. Again, so as we adopt this, what we call acceptance of the thoughts and feelings, because we understand why they are there, that can be a helpful perspective and something to keep in your coping toolbox. Another thing in your coping toolbox, and many of you may be familiar with these approaches because they have wide application. We can also use mindfulness to cope with grief. So for those of you who are familiar with mindfulness, you can think about how you apply it to grief and loss if you haven't done that already. But for those of you who might be less familiar with this idea, we think of mindfulness. To be mindful of something is to notice it without judgment in the moment, to just become aware of whatever it is we are feeling, experiencing, or sensing, but we're not judging it. And mindfulness strategies can be helpful in that way because you've heard me already punctuate this idea that whatever you're feeling makes sense, and we expect it to be there rather than judge it or push it away. So if you can adopt that perspective of, I notice these feelings of grief are there. And then we can use focus strategies, attention moving strategies to come back to the present moment. We can focus on anything engaging our senses. So it can be your breath. You can notice the pace of your breath, the sound of your breath, the feel of it, the temperature. Any ways that we engage our five senses can bring us back to the moment. So if you're having a wave of grief or something that feels in any way overwhelming, we don't want to push it away. We want to acknowledge it. But we also can move our attention and we can focus on things like our breath. We can bring our hands together. So the experience of touch can be something that is grounding and a focal point. But of course, as you're engaging in this way, your mind will inevitably go back to those thoughts, to that pain, and that's okay. Mindfulness, again, promotes this idea of allowing those thoughts and feelings to be, and then meditation practices help you focus on something else, again, with that permission to go back and forth between the two. So, again, just another tool in your tool box. Now, again, that connection between mind and body, our senses, can help us regulate emotions. So, while we certainly understand that we're promoting this idea of allowing feelings to be, we also want you to feel like you have capacity to be with feelings, that you have strategies to feel like you can allow them. And so in our toolbox can be all sorts of things. And this again applies to grief or all the things that are cousins of grief, like anxiety and worries and fear. So deep breathing can be a mind-body approach that can help us regulate feelings related to grief. Progressive muscle relaxation, for those of you who are not familiar with that, that is the kind of systematic tensing and then releasing of each of your muscle groups. So you can keep it something like that in your toolbox. Massage, again, anything where we have touch and our senses are activated, brings us back to the here and now in the moment. Acupuncture, exercise, again, using the body in a way to regulate emotions is something that you can keep in that toolbox. Now, I mentioned before when we were talking about coping flexibility, the notion of sharing, and sharing is something that to ventilate, to get witness significance, to have someone validate and normalize what you're experiencing. There is so much that can come from sharing. Now, I think so often in the realm of grief, there is a lot of fear around sharing. There is fear of burdening other people with your grief. There is fear of them saying stupid things, right? There are lots of fears that come around sharing your pain and your grief. And we can bring that into our discussion afterwards as well. But at the same time, if you can identify people who can hold space for your feelings, sharing can be so very powerful. So finding good listeners, people who have capacity and the listening skills to be there with you can be a very important tool in your toolbox. As can finding other forms of support. So you can have in your kind of friend network, your family network, people who you can share with. But we also recognize that there are other resources, and CPN does an amazing job of providing these kinds of resources. One thing that we want to think about when we think about, well, what kind of support does someone need, is just acknowledging that not everybody needs the same level of support. So we adopt kind of in our work around grief and loss, we adopt a public health model. What that means is that we recognize that different people need different things. And broadly, we all can use support and compassion around loss. And then some people might need more scaffolding and supports. They might really benefit from a support group. They might benefit from peer-to-peer connections, speaking with someone who gets it. They might benefit from a consultation with a professional mental health provider who can, in many cases, normalize the chaos that they are feeling, and affirm that the way they are coping is working for them when it might not feel as helpful as that actually is. And then there's going to be a subset of individuals who really could use more direct professional support, psychotherapy, psychopharmacology, and things like that. So we kind of adopt this model. Everyone could use support, but not everybody needs professional support. But use of support is a coping tool in your toolbox. Accessing the support that's there, that is a way of coping, and conceiving of it in that way as a tool in your toolbox, I think, is a helpful perspective. Another thing related to this, though, is recognizing that what you need may change over time. Your circumstances may change, the role that you have, where you are in this caregiving trajectory may change, and so your needs may change. And just being compassionate and understanding to that idea that your needs may change, I think, is also something to keep in mind. And now I want to turn to something that has been a focal point in kind of the realm of how we think about coping with loss in our work, which is around meaning making and finding meaning in your losses in your life. I talked before about this idea that loss can present a crisis in meaning. And so I want to talk a little bit, spend a little more time thinking about this idea. Now, when we're faced with a loss, I mentioned before this notion of shattered assumptions, kind of the loss challenges the way you think about things. And so when we think about, well, where do I go from here when I feel like nothing is making sense or I don't know how I got here? And you're struggling in that dimension, whether it's because you're trying to make sense of a diagnosis, you're trying to make sense of a way life has changed, or you're trying to make sense of loss after a death. um, Thinking about where you're coming from is so very important. So think about your belief system and the lens that you bring to your loss experience. What views do you have about yourself, your own capacity to cope? What views do you have about the world, the way the universe works? What past experiences you had, and how might they be shaping how you're responding to your loss? These are really broad questions, but they also can help you unpack why you might be responding and struggling, if you are struggling, in the ways that you are. So perhaps you have always been someone that says, well, I can handle anything that comes my way. And suddenly, whatever the experience is challenging that belief. It feels like this is hard to manage. And so you're in this situation with, like, oh, I felt like I can handle anything my way, but maybe I can't handle this. Or you feel like you can handle anything that comes your way and you apply it to the situation that you're in. You might have a meaning making system where you're trying to make sense of what just happened here, and you come at the world with the belief that people get what they deserve. Well, is that a helpful way of making meaning of this? So, what I'm talking about here is really just taking stock and inventory about the way you view the world. There are individuals who enter the medical complexities that they are facing with their child. Maybe came to the table with, well, I always thought bad things only happen to other people, but this is now happening to us. What do I do with this? How do I make sense of this? Or perhaps you're someone who comes to the situation with a belief that you have a hard time handling stress or anxiety, that this is something that is extra challenging for you. All of this to say that the responses that you're having to whatever it is that you're going through, again, makes sense. We want to contextualize it in using your meaning making system and be compassionate toward the lens through which you view the world. This is really, really key, again, because so often people don't understand or struggle to understand what is happening, and importantly, why they are responding the way they are responding. But you will hear me say over and over again that the responses you have, the reactions you have to your losses, to your experience as a caregiver, all make sense. So we want to punctuate that point. But another thing that we believe from a meaning making perspective is that we actually do construct meaning. So, on the one hand, we think about the fact that we are experiencing our reactions because of what we bring to the table. But we also want to empower you as individuals to think about the fact that the meaning we make of our experience is something that we can manipulate. We can choose a different meaning. Now, at the start, for those of you who are at the in the coming into the waiting room before we started the presentation, there were some quotes that were circling, and there was one from it looked like a mom that said, "I welcome the grief that I experience. It is a sign of my love." I might not be getting the quote exactly, but it was a welcoming of grief and a sign of love, right? That is a very, very specific way of making meaning. Now, in saying this notion, introducing this idea of choice, by no means am talking about a prescription of how you should make meaning, but rather, really, what I want to do is be highlighting this idea that we can construct meaning, and that means we have some agency in a set of circumstances that can feel so out of control. That is really what we're highlighting. And so, with that in mind, we can think about, well, what gives me comfort right now? What are more helpful ways of thinking? And when you think about what gives you comfort, when you think about a loss experience, something you've been through, or certainly, again, for those of you who have experienced the loss of someone in your world, the loss certainly of a child, for those of you who have been through that, and you struggle with kind of trying to make sense of this because this is can feel near impossible, we also can recognize our capacity to lean on a meaning, on a perspective, even just for a moment, to lean on it and use it, even if you don't buy it, right? So we can talk about and think about the fact that we are meaning making creatures. And if an idea, a notion, a perspective gives you some comfort, even if you don't buy it, you have permission to use it to get to the next moment and then rinse and repeat to get to the moment after that. So you can lean on a helpful perspective momentarily, and that includes making meaning of the grief itself. And that comes back to that quote that was in the waiting room earlier today. This idea that, how do I make meaning of this grief? Is this grief a representative of something that matters so much to me? Someone who is my world, right? So making meaning of the grief and holding it in a different light can help you experience it in a different way. And we could talk more about that. And I'm being really careful with my words here because I think so often we, certainly for professionals, we just want to be really careful that we're not prescribing a way of thinking about this. I really want to be clear that this is not about choosing a positive meaning or turning, lemons into lemonade. That's not really what we're talking about right now. We're more talking about your agency and how you construct meaning and kind of giving you the floor and creating space for this idea of, well, what helps you in a given moment? And can we support you in utilizing what helps you, perspectives that helps you, recognizing that ultimately you're the author, you're the one who decides what a given moment, a given experience, or your grief itself means. That's personal, private, and yours. When we're struggling in ways to help us with thinking about other ways that can be helpful, we can step outside of our situation, of our circumstances, and invite a perspective of compassion that often comes when we think about, well, the kind of kindness and grace we would give someone else. So that's just another, again, tool in our toolbox, is that stepping outside of ourselves and say, well, what would I tell someone else if they were saying, what's wrong with me that I feel like staying in bed all weekend? Well, after you've gone through such a significant loss, would you judge someone who was doing that? And so giving yourself the grace you would give someone else can sometimes be helpful. We also know that a big part of the caregiving experience and the responsibilities that come with it are the possibilities of guilt and regret. And we again, following the presentation, can talk about that more at length. But we want to be really careful about meaning making when we are all operating with a hindsight bias, meaning we can end up reflecting on history and events of the past with knowledge that we have in the here and now. So this is building on that notion that hindsight is 2020. So we want to be careful about that. Ultimately, we just want to promote that notion of being compassionate to your thoughts, understanding, but being compassionate toward the shoulds that we have, but gently redirecting our attention away from them. The idea here ultimately is that we're trying to kind of convey here is that we actually are the suppliers of meaning, and that is meant to be empowering and not overwhelming. Some of you may be familiar with the work of Viktor Frankl. He wrote this book, Man's Search for Meaning. So those of you who are familiar with this idea, Viktor Frankl talked about his experience in the concentration camp and the suffering that was witnessed at every level: physical suffering, spiritual suffering, existential suffering, emotional suffering, and the lack of freedom, the freedom that was taken from the prisoners in the camps. And what Frankl remarked on was that the last of human freedoms, when we were in these dehumanizing or out of control circumstances, the last of human freedoms, the thing you always have control over, is your ability to choose your attitude in any given set of circumstances. So again, that word attitude is awfully loaded. We are talking in that word attitude about a response. We're talking about how do you choose to respond to your circumstances. Now, some of you may say, response, choice, what the heck are you talking about? I have no choice. I have to do this, whatever this is, continue to care in the way I have. I have to get out of bed. What am I going to do? Stay in bed all day? One thing I want to punctuate about that I have to's, I have no choice moments in your life is that often, and this is not to invalidate the feeling of being trapped by circumstances, but what I want to highlight is that when you are in a moment where you feel like you have no choice, you have to, what choice do I have? What am I going to not do this? You're operating in a way that is often so aligned with what matters to you, so directly reflecting what is meaningful to you, that it feels like you have no choice. But it is because you are operating in a way that is exactly capturing and aligned with who you want to be in this moment. So the person who says, what am I going to stay in bed all day? I have no choice. I got to get up. I got to get up to help my other family members. What we want to highlight here is in that moment for that individual, well, of course they have a choice. There are plenty of people who may lay in bed. And if you are one of those people, that is also a choice to take care of yourself and your grief in that way. But what we want to punctuate here is that in that moment of getting up and doing something different, even though it feels like you have no choice, the why underneath that choice has meaning. There is something that matters to you so much that you're going to go ahead and do it anyway. So we really, again, are just opening up this perspective that in moments where we can feel trapped by circumstances, there are elements of agency, and what you choose to do often is reflecting what matters most to you. And we want to bring that to light because connecting to sources of meaning, the things that matter to you, can help you feel a sense of meaning. And a sense of meaning when you are grieving can buoy you. Because this notion, and some of you may be familiar with this Nietzsche quote, Frankl talked about this idea that in the concentration camps for the prisoners, observing individuals continue to carry on despite unthinkable circumstances. He brought to light this idea that he who has a why to live for can bear almost anyhow. This notion that your whys, those sources of meaning, the things that matter, can help propel you through the hardest of circumstances. And your whys can become your lighthouses. They can become the things when you feel like you are drowning in your grief, you are lost, can help you steer your ship towards these things that matter. So we really want to raise to consciousness, what are your whys? What are the things that matter? That in the sea of grief, when you feel like you are overcome by it, turning and steering toward those whys, remembering them, bringing them to consciousness can be a way to help you stay afloat, can buoy you. And so we want you to think about how to stay connected or reconnect to those sources of meaning when you are grieving, and reflect on who you want to be in the face of loss. We can do this by thinking about, well, who was I before whatever this loss experience was? Who do I feel like I'm now? And who do you want to be? Because I am not what happens to me. I am what I choose to become. Again, these ideas are not about turning lemons into lemonade, but more to promote agency and a sense of empowerment so that we understand that in the face of suffering and in the face of grief, you recognize your capacity to have choice. I'll leave you with just our own work and sense support for anyone who is facing grief in any way. We can help connect you to community grief support or give tailored grief therapy referrals. And just conclude by thanking you for your time.
Wendy, thank you so much. I want to remind everyone that we will be sending an email with additional resources, including the links Wendy just shared on those last few slides. That was a really, really rich presentation with a lot to digest. I have many questions myself, but the chat has also been active, and so I want to start there to make sure that we address a few things that have come up. The first of which was this idea of grieving in relation to others. Um, how do we pull them along with us? How do we get them to understand what we're going through? You mentioned the stupid things that people say. Um, what are your thoughts on that?
Yeah. I mean, what really stinks is that people struggle to know what to say, and it's often can feel like the burden is on the griever to figure out how to educate those around us. um, so we can frame that as something that is empowering, that we can be we can let people know what we need, and recognizing for anyone who's experiencing grief that you need different things at different times. So helping those around you know what you need, whether it's a listening ear, someone to say, yeah, that sucks, don't problem solve for me right now, I just need to say this, okay? You can give someone a little bit about a little coaching there. Do we wish that people got it right and knew automatically? Absolutely. We wish the burden was not on the griever. At the same time, what we don't want is you to feel so alone and feel like nobody has the playbook. So one thing you can do again is that do that coaching and that education. You also can know that different people are good, kind of helpful for different things. So kind of identify, and many of you may have done this as caregivers, is kind of figure out, you know, who is good for what? Who are my listeners? Who are my cheerleaders? Who is the person who I really actually don't want to hear a thing from them, but they're good to go for a walk with, or a movie, or something where they don't speak, or they'll be practically helpful for me. So identify, you know, understanding that we can coach some people and train them and tell them what we need, and there are other people where their capacity, for whatever reason, is limited. Our work and what I believe greatly in is that we want to build grief literacy in the world, and there are more and more resources to build grief literacy. And there are ways that you can, for those in your world, get them connected. There's a lot on social media, and you can connect people to those sources of grief literacy on social media, so they start to get kind of the good information, the helpful information, so that's not left to you. But the fact of the matter is that there still might be people who are well intentioned and still are hard pressed to find the right things to say, and recognizing that, and you know, not going shopping for ice cream in a hardware store is another perspective that we can adopt, and pivot to find those who can help. I said before, professional support, not everybody needs professional support. Sometimes you have outstanding coping resources, inner resources, and that professional support is the place where you can go, where you don't have to be over considering protecting others, worrying about others, and that is a safe space. So professional support, group support, of course, all of that can be a way to cope.
Thank you. And then there was a few messages about the cognitive effects of grief. So lapse
Yeah,
in memory, especially soon after a death or a loss. And then another one mentioned brain fog, this idea of
absolutely.
having foggy brain. And she said that she wants it to be linear and knows that it's
Oh,
not. That
of
resistance
course.
and that feeling of when the trigger comes back and you have not just the emotional sensation, but also these physical sensations and cognitive sensations that go along with that.
Absolutely. I mean, so much when we talk about that, and what we all can do is validate that for anyone who's grieved. You know that experience. And we want to validate it because we want it to make sense. Like, what is happening for me here? Again, I keep coming back to the sense making, but it's because the natural response to grief and loss is highly uncomfortable, and so we there's a tendency to think something is wrong, or that when you find kind of some you get kind of your bearings, feel things feel less intense, and then there is a reminder, or your that brain fog comes, or you're having difficulty concentrating, that you think, well, what's happening here? Am I going backwards? Am I regressing? No, this is grief. This is what it is to grieve. And so making sense of those responses so that you kind of surf the experience and don't feel badly about feeling badly. You know, I always say when we're supporting grievers, that we can't take away the grief. That's not what this is about. If we can do anything, it's help people feel not feel badly about feeling badly, right? Make sense of their responses, which is why I'm, ad nauseum driving that point home. But yes, of course, that is real. You want to validate it and find, temporary ways of adjusting. I say temporary, but for however long it takes. If that means modifying your environment, because, I'm not going to remember that. Let me write that down. Let me put a reminder. I used to remember all of this, juggle 50,000 things. Not doing that right now. I need to kind of adapt and pivot, acknowledge and validate the fact that my brain's not functioning in the same way. This is part of the stress response that we have to loss.
Mm, thank
Yeah.
you. Are there other questions? Jennifer, I know you well enough to know that you likely have a
Sure.
question.
So I was trying to put myself back into the place when I was caring for Ben and thinking about Wendy, when you were talking about all of the losses along the way and the things that fall away and how to cope with that. I would hold in one hand the joy of remembering the skills or things my son could do or the way he expressed his personality, and at the same time beholding the immense sadness of that it was no longer the reality. And um, sometimes you feel like you have a split personality because you don't really know which one to embrace. So, could you just speak to that a little bit for the parents who, I mean, I think a lot of the parents that are here are experiencing a similar trajectory.
Yeah. I mean, I think it is that both and that's an uncomfortable for us to be in two places at once, as you're alluding to, Jennifer. Um, and it's a reality is that you're gonna kind of feel like you're in both places at once. That one of the earlier slides I had there is, grief and hope can coexist. Grief and being in the present you can be grieving and appreciative, right? There's a lot of and in the caregiving world, and recognizing our capacity to hold more than one set of feelings at the same time, I think is important to making sense of the response, and that there's not a should. I mean, we are driven to be like, well, what should I be doing right now? What should I embrace? It'll happen organically. And then your task, when we get meta, when we step outside of what is happening here, say, yeah, of course, I am grieving this. I wish it, I wish for that. I remember it with all these mixed feelings. And I also maybe feel gratitude for this moment right here. Or I feel gratitude for the memories that I am able to, and the time that I've had and all of that. And this idea that we can hold grief and gratitude, that we can be sad, and appreciative, and it can feel crazy making. It is an and experience, and I think that's important to punctuate. And there is no should or prescription. It is merely the perspective of permission and allowance, because we acknowledge this is how we operate as human beings when you are in these experiences that are hard to hold, right? So yeah, I'm glad you raised that.
Thanks, Wendy.
Wendy, I'm mindful of the time, but I want to ask one more question on the issue of meaning before we wrap up. Uh,
Yeah.
Parents will say, I see no meaning in this diagnosis. There is no meaning to me in my child's death or what's happening here. But I think what you described is there's still space for meaning that isn't necessarily that. So,
Right.
what is the question that we can ask ourselves that is not, have you found meaning in this loss?
There's so much to say about this. So first of all, I think when we think about, have you found meaning in this loss? People go to, have you made a positive meaning of it? Saying there is no meaning is technically a meaning. It's, you know, it's trying to understand what happened here. Now, everyone will have a meaning, including there is no meaning, like and what can be meant by that is like, this is not as I expected. This is life out of order. There's no higher order meaning to this. And that's a meaning. Like, that's not how you view the world, how it operates. That's okay. And there are other ways we make meaning that are not about, this was orderly or predictable or made sense in my universe. And that can be meaning in the caregiving experience, right? So while you might not be making meaning of how did we get here, you can have meaning in a moment, and find meaning in that connection, or meaning in the way you were as a caregiver and the choices you made along the way, and so on, or meaning in how you continue even after the loss of a child, how you continue that connection, how you continue to nurture that relationship, or legacy. And it's a loaded word, so I'm being careful there. But there are different other ways that we come in with meaning that, again, are some that don't have to do with making positive meaning, but just organizing our experience. Yeah.
Thank you so much.
I think Blythe has something.
Blythe, did you have a comment?
Wendy, lots of comments about how fabulous this has been, so rich, so comprehensive, and you're a phenomenal presenter. I'm just thinking, I just want to name something that came to me, which is that, and I think this is what patient disease groups do for their members and what Courageous Parents Network tries to do for everyone in it, is that I'm remembering, I loved your differentiation between illness in the moment grief and anticipatory grief. And those are two different things, but of course they're all in the moment. The child is alive, or the person that you love is alive, and these two different types of grief. And I'm remembering that my daughter Cameron was alive, but I was anticipating her being dead, and I was afraid. So I was having the illness and the grief in the moment, and I was terribly afraid of what my future was going to be and how I was going to survive her death. And then my nephew Hayden died, and I got to see my brother and sister-in-law, who were just 5 months ahead of us. So I suddenly had the reassurance in these two people who were so close to me, because their son had just died from the same illness my daughter had, model for me that my future, the uniqueness of that moment, which is what I think parent to parent does, right?
Yeah.
If you can see somebody who has survived it, you can be in your immediate grief moment, be thinking of your future self moment, and see from those other people that your future self can handle that grief with the right support and all of that. I hope that makes sense.
Total sense. And I was just lecturing to some physicians earlier today around, you know, this grief that occurs before a loss. And what I was talking about is one of the things about that here and now loss is that you can also show someone that they can be with distress. Along the way, it's not just the modeling, it's also that when you are with the grief over the losses that happen in the here and now, you are being with grief. It's not, and again, it's when you try to imagine that big grief, it can feel impossible. But we are witness along the way of our capacity to be with pain. And so much of what I'm talking about what we're talking about when we're talking about grief is it's excruciating. And so our beliefs about the meaning we make of the pain and how you kind of maneuver or think about it, in anxiety, we call it a fear of fear model. It's a fear of grief. And we want to help people recognize that they have capacity to be with it. They don't need to fight it. And that there are things that we can do, like change the meaning of that moment of grief And again, I don't want to impose this. This is not for a professional to impose what that grief can mean, but certainly we saw it in the opening, the quote was Jessica, that quote that said, "I welcome the grief. It's a sign of my love." And I might be misquoting it there, but that's a meaning making. That's changing the meaning of this pain when I welcome this pain because it is a sign of my love, right? So what we're doing here, again, what this is coming from another parent is reminding you of your capacity to make meaning of feelings in the way that Jessica did, to help you be with it, to help you surf that moment.
Mhm.
Incredible, Wendy. As I said before, there was a lot of rich information in this presentation, and I, for one, am grateful that the recording will exist. To go back and look at it will be on our website and also emailed to all of you. Moving forward, we hope that you'll consider joining us for our next In the Room in January, which will be about siblings, another popular topic. And as I said, we will be sending you some resources along with this recording within the next few days. And with that, thank you all and have a good evening.
Thank you all.